Welcome to the Bringing Intimacy Back show, where intimacy is real. If you desire to intimately connect with yourself, significant other, children, family, friends, community, and higher power, then this is the show for you. We explore intimate topics, inspiring life stories, spirituality, and insightful tips on strengthening relationships. The show is hosted by Dr. April and her co-host, Coach K. Let's get this episode of the Bringing Intimacy Back show started. We share with you today the secret power to intimacy to create the life you love or love the life you create. Now here's your host, Dr. April, and her co-host, Coach K.
Welcome to the Bringing Intimacy show, that show where intimacy is real, and Dr. April is right there. You just gotta unmute, and we are there. We go. I love our live shows. Listen, I love them.
Yes. Thank you so much. Yes, and so we're excited because today we are in the month of June, and in the month of June, there's a lot of things going on. But one of the aspects of the month of June for mental health is the aspect of trauma. And one of the topics that we wanted to really talk about that it's not really discussed much is intimacy after cancer.
That is such a major topic because while we know that we fight for so many the cures and the causes and all that good stuff, we never think about what's happening in the personal life of the folks. So this is definitely a much needed show.
Right. And sometimes when the couples and people or individuals are going through that, they don't even think about it or ask questions. It's like, you just had a life-threatening thing that happened to you. And then the question of, sex and pleasure and, yeah. But it's really important because it affects so many individuals and couples
every single day. So this is definitely a much necessary and needed conversation.
Yes. And so before we get into that, one of the things that we always talk about is the charity of the month. And as I said, the month of June is actually post-traumatic stress month. So in helping people find resources for that. So one of the great charity is the Trauma Survivors Foundation. It's a great charity because its goal is to help to improve the lives of children and families and putting them with resources. So their website, if you're wanting to think about them or donate or even find out more information, is www.thetraumasurvivorsfoundation.com.
Sounds like a great foundation. And what I love, I probably don't say this enough, but I love that you're able to bring forth so many different charities that we otherwise may not know about. And especially this one for trauma survivors, a solid place for them to get support, to get help, to know that, no, you're not alone, and to be able to see the various types of trauma. So thank you for bringing this one to the forefront.
Okay, yes, which I think is a great aspect. And what I'm really looking forward to is we have an expert coming in, and his name is Dr. Dizon, and he is a professor of medicine and, of course, a professor of surgery at Brown University, which is very prestigious. And he is a medical oncologist who specializes in helping individuals, men and women, with pelvic, with cancer, with intimacy, and he is really a phenomenon person. So I just can't wait to hear about him. We're going to take a short break, and when we come back, we're going to learn all about him and ask all the questions that you guys may be thinking about. And if you have questions, please put them out there on Twitter, Facebook, or message me directly. We'll be back in a moment.
Life can be overwhelming sometimes. We think we are a burden to others. We think that it's better to hide it and suppress our hurt, but it's not. As Cape Coral therapists, we will provide you with quality, confidential counseling services in a relaxing and peaceful environment. Talk to a professional today. Book an appointment on www.capecoraltherapist.com or call 239-565-6921.
Welcome back. Hello, Dr. Don.
Hi, how are you?
I'm doing great. I'm doing great. Yes, welcome to the show. And I love the yellow flower there. Yes.
Yeah, it's a little sort of a side gig. I don't do it for money, but I am obsessed with making these paper flowers.
Yes. So, Dr. Don, you have so much knowledge, information, and resources about cancer and intimacy. My first question, though, is how did you get into this field?
Yeah, it's a question that I get a lot, and I actually attribute it to my fellowship. So I was a fellow in New York City at Sloan Kettering back in the late 1900s, and back then, we had chemo. We didn't have all of these really amazing drugs that have come along, immunotherapy, precision treatments. But I was on a floor where we specialized in reproductive cancer, so ovarian, vulvar, cervix, uterine cancers. And the suite opposite us was where gynecology was. And as part of gynecology, they had a sexual health program specifically for women with cancer. And I worked with them very closely during my fellowship and when I became an attending there. After I decided, after I had children and decided didn't want to raise them in New York City, I moved to Massachusetts. And my first job outside of a major metropolitan area, I realized there were no services to talk about sex. There were no services at all, apart from talking about cancer and Coach K, like you said, cancer treatment, cancer side effects, but there was no resource. So after my experience at Sloan Kettering, I thought it was shocking that we didn't have that resource. I went to my boss and said, I think we need a sexual health program. And the first question they asked me is like, what makes you qualified to do that? You're a medical oncologist. So what I ended up doing is I actually became trained as a sexual education counselor with Planned Parenthood. So I was a doctor and attending in oncology, taking sexual education courses, which really focus on transmittable diseases, right? But it was about how to talk to people about sex. It was a refresher on the anatomy of both men and women, their pelvic anatomies. And, I think it was just enough to make me comfortable and also give me the credibility that I could actually go into this space. So that's when I actually started these clinics. I started one at the Women and Infants Hospital here. And then when I went to Mass General, I started a program at Mass General. And then when I was recruited back to Rhode Island Hospital, I started the program here. I've been doing this work now, I think, for almost 15 years. But it was really borne out by the shocking realization there was nowhere for people to turn to. And quite frankly, back in the day, I was, when I heard my attendings speak about, to their patients, and their patients say, you know what, I can't have sex anymore because it hurts so much. The response they used to get, and I think what concerns me is that people are still getting it, the response was always, at least you're alive. You should be grateful for at least just that. I know, shocking, because it's such an inherent part of life.
Yes. Well, let me say that I can appreciate that you laid out how that journey went for you, because I think we all forget. Yeah, you can be a professional in this thing, but when it comes to the sex and the sexuality piece, you have to get that additional layer of comfortability. Because for the response to be, well, at least you're alive, that's someone who's not comfortable having a real discussion about. But sex is a major part of a marriage, a relationship, a life in general. So kudos to you for starting those.
Well, and I think you mentioned something really important, Coach K. The whole point of my doing this is I wanted to give, air to these conversations. I did not become a sexologist, right? I did not become a psychologist. I did not become a marriage counselor. But what I was able to do is I formed a circle of specialists, and I was the entry point to help to get people to where they needed to go. And I think that's really what I keep telling people like me and in cancer land. All you have to do is let people tell their stories as it relates to this, especially, and not shut them down and make them feel like you're not owed this. My part was just to keep you alive, and I'm doing my part. So go out and live. I mean, it was just sad. And so that's why I went into this.
Okay, thank you so much. And I was just thinking, if we start from the beginning, when someone is diagnosed with cancer, um, what are some of the questions that they should ask in the beginning?
I think that's a really important one. And, when I came to the institution I'm at now at Legarrette Cancer Center and Rhode Island Hospital, they were collecting what's called these distress thermometers for people when they first entered the program, when they first entered our program as a person with cancer. And April, you said something really important before. There was so much going on in their mind, right? It's like, am I going to live? Oh my God, it's cancer. What's going to happen to me? And it turned out that you were right. The issues about intimacy, sexuality, relationships, dating, that wasn't anywhere near the top of what these folks were experiencing. They really wanted to know what are we going to do? How sick am I going to be? And what are my chances of not dying from this cancer? And that was one, two, three, with all the anxiety and depression and everything that goes along with it. So, it doesn't mean that you ignore it, right? So I think the onus then is on us as docs, because, we're taught, right, to take a history. It's like, well, medications, what's your family history, what's your social history, do you smoke, do you drink alcohol? All I keep telling folks is like, it's really up to us to open the door. They may not want to walk through it, but if you say cancer sometimes affects people in relationships and it gets really hard to reconnect, is that something you want to talk about? 100% of the time, they're like, no, I don't want to talk about that. But at some point, they will remember you brought it up. And when they're ready, they will say, you asked me something when I first met you, and I'm now ready to talk about it. It's if you think that people like are going to just say, oh, you know what, I can't get erect, or I can't, my orgasm is not what it used to be, or it hurts when we have sex. They're not going to do it unless you've opened the door. They just won't. It's so private, you know. They want to know that they're not going to be shut down and be told, well, at least you're alive. Yeah.
Yeah, and I was just thinking, and when people go through that, the treatment and all that, I mean, their body is exhausted. Their body is, and then as they start to get better, when they start to go back into a kind of a normal life, you know, and many times, sometimes partners says, well, you've had all this done treatment, we're back to normal. Yeah. And then they try and it doesn't work and they get so distraught. You know what I'm saying? Yes. Yeah. So that's why I was thinking, is there any way of preparing people before they hit that trauma of, oh my gosh, this doesn't work? Because sometimes once that happens, it takes maybe months or years before they actually go and
Right.
see a doctor.
No, I think you're right about that, and it's a really important thing just to point people towards resources, right? To say if you ever need this, so that everybody who gets cancer, I don't know, but most centers they have this book that they give people. It's like this is a book of resources. This is a book about and it contains what your regimen is going to be. It's something about your cancer, about the side effects. But very rarely is there stuff that talks about intimacy and sexuality in that book. And I think that's one of the easier ways to change things, right? It's like, if you're experiencing something and you're ending treatment, it should be in the book. You should be able to refer back and say, oh, there's something in there. I remember reading about it. Private, you use it when you want to, right? But, I have to say, that's the one piece, Dr. April, that we still haven't figured out. When is the right time to prepare people for that, right? So when people are finishing, let's say we're treating someone and, my goal is to cure them of their cancer, right? I will actually try to speak with both. If they're in a relationship, I'll try to speak to the both of them before the treatment ends to prepare them what it's going to be like. It's we kind of think outside of cancer world, at the end of chemotherapy, you should be happy. You made it. Let's have a party. But it's a really scary time for people because all of a sudden they don't know what's going to happen next. It's like, oh my God, am I going to recur? I don't know what's going to happen. It freaks people out a lot. But I think that's the time when you bring everybody in and say, you just went through something scary. You need to try to, you know, I want to help you try to, work through that, but also let's see how you guys are connecting. And that's the time you start asking questions. Have you guys had a chance to decompress and figure out what was this like for you both? Have you been intimate? How are you doing emotionally? Because sometimes what you see is that people ending that treatment period for a cure, the people who don't have cancer just want to get out. They just want to get out of the cancer. It was so scary that they just want to get out and resume their life. But the people who actually lived it and were treated and are having their hair grow back, right? Or maybe they have some numbness and tingling in their hands, they are constantly reminded of what they went through. So they can't just escape this and go on with their life because, like Dr. April, you use it right. They've been through something traumatic, and they need to try to work through that. So much of what I try to do is sort of equal it out so that they're kind of seeing things in the same place. And I think that's one of the steps to try to prevent, the damage to relationships because it can be really hard.
Yeah, I was wondering in my mind, I was just thinking, because my dad previously had prostate cancer, and I know women who have had cancer in their pelvics and all that. And I wonder if there's even a difference when a man has cancer. Do they talk about it a little bit more? Because it does affect, but it also does a gigantic effect in the women when she has cancer, even cancer in the breast and the treatments and all that kind of stuff. Yeah.
I think, and I love the fact that you're bringing this up because it's all about the intimacy. You know, it's like when you talk to men who have cancer, and you talk to them about how intimate are you, they jump to penetration, they jump to erectile function, because I think for men it's always thought that erections and intimacy are the same thing. They're experienced the same way. It's so tied together. So for men, we prepare, right? Your father probably was like, oh, if you do this, this is going to be what's happening when you urinate. This is the risk to you for getting an erection, right? They get all this preparation. Doesn't happen for women. Doesn't. We don't talk like if you lose your breasts, you're going to lose what is an erogenous organ that gets you aroused. For 99% of women, it's an arousal organ. You're going to lose that. Or we don't tell women who have cervical cancer, if with radiation, there's a chance the vagina may close if you don't take care of it. We don't tell that to women, and this assumption that intimacy is all physical, and when it's not true. I keep telling the folks that see me because women will come and see me. It's like I have no desire, right? That's really the main thing. But when you walk it back, it's almost like the first time they tried to have sex after a cancer experience, it hurt. So why would you want something that hurt? Your desire is being diminished because there's no joy in it. There's no pleasure, right? So trying to figure out where we want to start. And then the big thing is it's about the intimacy, right? So intimacy in women has nothing to do with sex, like physical sex. And I keep explaining, it's like if you've ever been, nauseous and, lying on your couch so tired from chemo, but you have to prepare dinner. And then all of a sudden your partner prepares dinner. That sense of desire and just having your needs fulfilled, that's real emotional intimacy. That feeds a sexual relationship. That's not the same thing in men, is what seems to be the case. Yeah.
So I've watched a show that comes on, and the woman, she had cancer. She was kind of in the middle of it, and the husband was what you're saying. He's like, hey, I'm not getting any. It's all in your mind, is what he said. And then, and he didn't think two thoughts about it. And it's like, even if it is just in her mind, she's going through this thing, but he's also going through this thing on the other side. So while we cater to the patient, we don't always think about the caregiver. So when you have this setup, because you say you bring them both in, which I think is amazing, because we do have to be able to, and I feel like if we show the caregiver that, hey, you're in this too, then they're less likely to be so, hey, it's all in your mind. I just need this, and understanding. Do you find that there is a difference when you do include them?
Yeah, that's so interesting because when I first started this work, I did women's sexual health. I was only focused, and I would only talk to the woman. I didn't really give it, I didn't really care about the male experience. I was like, how are you doing? Are you having pleasure? What's happening? But really learn quickly, you got to talk to them both. Cancer affects both people in a relationship, and it changes so much. The most extreme thing I can tell you is the stories that stay with me about this, I really bring it home, are people who underwent a bone marrow transplant. Now that it's not surgery, but you are wiping out someone's immune system and you're giving them something else, right? You're giving them a donor's immune system, and you're hoping that that immune cells that came from your sister, your brother, doesn't kill you because they could recognize your body's foreign. So there's this thing they call graft versus host disease, right? And I remember when I was in Boston, I used to see these folks who were just so sick post a transplant. And just their skin was, just being attacked by the transplanted cells. Sometimes it affected, you know, a man's ability to have an erection. They were infected all the time, going back and forth. And they would come with their partner because they really wanted to work on their relationship. And the problem, Katie, is that the caregiver was just that. They were taking care of someone who was really sick. So when this person who got the transplant was not sick, was feeling actually, I'm having a good week, let's have sex. You have a caregiver who has literally been trying to keep you alive, giving you antibiotics, cleaning you up, helping you go to the bathroom, bringing you food, and just, I still have a hard time. I would love to hear what your thoughts were about this, but such a hard time getting them to the same page where you got to understand what he or she is going through, because they can't switch it off and say, now I can have sex with you and have fun with it, because the entire time they were just trying to prevent you from getting sicker. And it's so hard, but that's the experience in cancer land for a lot of people.
And Dr. April, I won't let you because I'm just going to touch on that. And it's not necessarily cancer related, but because I have a heart condition, so I have a chronic illness too. And my husband watched me go like tank and super scared. And so sometimes he's like, I want to ask you, but I don't know how. And then at some point you just sit back and they don't want to. So I think it's just giving them that permission to be okay saying no, even though, I just helped you get through these tough times. It's okay for them to have a true say in the matter when it comes to the sexual piece. Actually, I'm not. So giving them that openness, or some, even writing out a little note card to give to the partner of how to politely let the patient down in those instances, and here's why. Or you saying to them, this is what your partner sees on a daily basis. You're down and out. You may not make it to the next hour, let alone the next day. And so when you are up, they still have that in their mind. So just reminding the patient of that, but just giving them that permission to say, no, I don't want to have sex. I can't. I'm not, my mind space is not there. I think is a big thing.
Yeah, and having them see it not as rejection, right?
Yes, you two brought up a very important point in the sense of going from that caretaking to that romantic stage, and not feeling rejected. Yeah. And so sometimes it's first is having that conversation, that, because that switch doesn't happen immediately, it takes time for that to happen. But also sometimes just helping them come up with creative ways on how to be intimate. And like as we talked earlier, and intimacy does not always mean sex, it's that connection, because that can really, and even I explain to women and men, you can have an orgasm without anybody touching you, because it's the mind here, it's the connection. And that's what's, so important in a relationship.
Yeah, I agree 100%. There's actually something I try to, so in the cases of people where it's been such extreme caregiving and, it's almost like the fluctuation between I feel really good to I am crashing and I need to go to the hospital can be so extreme. One of the ways I try to bridge it is through sensate focusing, right? It's a sort of, it's touch therapy. It's like, just try to see if we can connect through touch first. Let's try to reestablish what intimacy looks like. Because if you think, you know, I'm the one that misses having intercourse while you're so sick, that's not my mind, right? And for the person who has been very sick, it's almost like I wanna, I wanna give you something, I want you to give it. And if you don't want it, that's like you're rejecting me. So getting them to the point where sex is off the table while you work on connection. So I totally agree with you, April. It's all about connections in the end of the day.
Yeah, another thing I was thinking about is also sometimes even changing the setting. You know what I'm saying? If you're doing the caretaking in the main bedroom, but you have a guest bedroom, and if that's where you feel, just changing that for one day into the guest bedroom, it's just changing the setting. Even if you were to do role playing or whatever, just changing it so it's different but also creative, because that's really important. One of the things that I do want to ask in the sense of creativity, what advancement and cancer treatment and sexual health are you most excited about that are coming out to help with this issue?
Well, I think it's really the importance of what you two are bringing to the table, honestly. It's like, we have these drugs for men to help with erections. They don't work on everybody and they're really expensive, right? These PD5 inhibitors are called, like Viagra, Cialis, and all these things. There's a tendency to think that men have all of these drugs and they have all the pleasure pills. The reality is, so many people can't afford it. They just can't. So there's a way to try to figure out how to get on those pills. So much of it, I love what you said, Dr. April. So much of it has to do with getting people counseling, getting people to a sex specialist who can actually let them sort of reimagine what intimacy looks like, both emotional as well as physical intimacy. But it's true, the surprising thing is that, say, let's just take women's sexuality, right? There's this tendency to think you can't give people hormones if they have cancer, right? Everyone's kind of afraid of it. But if you look at some of the diseases I treat, like ovarian cancer, uterine cancer, cervix cancer, there's really good data that if you give back those hormones to those women after those diagnoses, you can improve their survival too. So not only can you make them physically feel better with estrogen, but compared to people who didn't get estrogen, who had those cancers, their survival's better. So it's true. In breast cancer, we try to stay from oral hormone therapy or hormone therapy you take by mouth. But even for them, there are these preparations that can be utilized to help with desire. The trouble is that these treatments for women who, to help them with their desire, say nothing else is wrong. It's just like they just can't get there, right? It's not Viagra for women. These are pills you got to take every day. Who wants to take another pill every day so they can have good sex life? It's a real challenge. But I always tell the folks I see in this sexual health plan, the magic pill doesn't exist. You know, it is. It's a mind and it's a body connection, and it's intimacy that is separate from physical intimacy, But that's a really important thing to do. So I would say that the biggest thing I'm still trying to push is the idea that sex after cancer isn't simple. It's not simple, you know, and sometimes you need more than one person to help you find your balance again, find your groove after cancer. And that's why I think what you both are doing is so important.
Yeah, and one of the things you just mentioned that we kind of haven't talked a little bit about is body image. You know, because that's really important. What you feel for your own body and how you bring that into an intimate relationship. Yes, yeah. And so, how do you help people gain that back?
Well, you know, I tell particularly for the folks who've had external surgeries, right, that really impact them. But this is not only that, it's chemotherapy. Some people, I think most people have this idea in their head that if you get chemotherapy, you're going to look emaciated or anorexic, right? The exact opposite happens. On chemo, people gain a lot of weight, you know, and so they're not expecting that either. So all of a sudden, you know, despite the fact that your partner can look at you and say you are still the most beautiful person I've ever seen in my life, and I still, every time I see you, I'm so still so attracted to you. You would think that'd be enough, but really, Dr. April, to your point, the biggest voice you're going to hear is the one that's staring back at you in the mirror. There's nothing after cancer that people can say to you that won't silence that particular voice. So, what do we know about body image? One, time is really critical. You know, that voice will become less um, important as time passes. So giving yourself that space to be, you know, upset for a bit, knowing that the clouds will part, you know. But the second is there's actually really good data that after cancer, being in a group of people in the same situation as you can really help. So, you know, relying on a community of people who understand what you're going through or dealing with the same kind of issues as you in terms of recovery from cancer, including from body image, that can do, they won't uh, get you to who you were before the cancer, but it will speed up your ability to recognize who you are now, what we sometimes call that new normal. You know? So I think that's one of the things. But you really just, I can honestly say, one of the biggest things I do is normalize things, right? You know, if someone says, I look horrible, my reconstructed breast looks horrible, you know, I'm not going to be their cheerleader saying, you look great, don't worry about it, you know, everything's fine. You could pass for not having had cancer before, right? It's more about just saying, and it's okay to feel that way because a lot of people feel this way. A lot of people have been in your shoes and are in your shoes. So this is not your own experience. There are people who are exactly in that situation, and you are not alone in that. And just that can be the start of saying, you know, it's not just me. This is actually a normal situation. And I think that again, it's about giving people permission, right? To say life isn't good right now. Because sometimes after cancer, we all just want life to be good. You survive something. You should feel great. You should celebrate every day that you're here. And, you know, sometimes when people look at the mirror, they don't see who they want to be. You know, that's hard. And giving people that space to say, this is hard, is something else I want to empower people to understand that they are owed that after everything they've done. You know,
I I can appreciate that you would rather be completely transparent and honest than to just make people feel good. Because I think going through a realistic situation as cancer, that patient does not need to be fluffed. They don't need, because they're hearing this the whole time. You're gonna be okay. It's everything is gonna be all right. The cheerleading section. So to have a doctor that's like, you know, this is the reality of it. This is what's happening. I'm not going to feed you that you look amazing because only you know how you feel about how you look. So being able to give them that may make them look in the mirror and say, you know, let me look at me differently because you did not lie to me. So let me create that reality. So I can definitely appreciate that.
Yeah, I can say it's like when I first started this work, I treated a couple of women. They came almost at the same time, but they had gone through breast cancer. They had had a mastectomy, which and then reconstruction, and the reconstruction was awful for them. And they ultimately just said, "I don't want to go through this again." And that they removed the reconstruction and were just flat, you know. And they were in relation. They were both married, but they would never undress with the lights on, and they would never take off a camisole in bed. So their partner never saw their chest. And they were not even aware they were doing it. So the way it came up was just asking because they were seeing me for, again, sexual, lack of intimacy in their relationships. And I was like, well, have you been intimate? Are you guys having intercourse? And tell me about the last time that happened. And it was only when she was sort of told me what her process is and the fact that she never would let her partner into the bathroom when she showered. He was not allowed to see that. But just saying, it seems to me that this is happening. Are you aware of that? And it was just like, I never really thought about it. And I was like, I think if we could explain that this is where you are and this is what you need to do so you can be intimate physically. I think just understand so your partner can come up, Coach Kate, to your point, they need to come up to where you are, you know, is so important. But so many times the caregiver, the partner, is just not, they don't know what to do. You said it's like, I don't know what to do. I don't know how to ask. I don't know if I should ask. It's like, if I tell you I want to see you, the complete you, are you going to freak out on me? You know, it's like, I don't know what the rules are anymore. So, but sometimes the person who's treated with cancer, they don't know what the rules are either. They're just trying to feel it out. And I think the sad thing is, we don't have two people like you at each cancer center to say, let's figure out where you are so that we can prevent them from having to see people like me.
Wow, that was so informative, and I love how we really are talking about it's learning how to accept the new you, and even the relationship. It's not as it was before. It's going to be a different relationship. So, Dr. Don, what resources or things that you recommend for people for cancer patients or people who are helping take care of a cancer patient? And then how can also the people that are listening connect with you?
I think there are some really nice books that are made for people not in oncology. My friend Ann Katz has great books called, I love it. They're very simple. Women, cancer, sex. That's what it was. And she has the ones like men, cancer, sex. You know, my colleague from Sloan Kettering back in the day, Michael Critchman, also has some nice books out. There's a foundation called Patty Brisbane's Foundation, and she's all about sexual health in women, just really empowering women to like ask these questions. And then I think in the cancer world, if you go to advocacy organizations like the American Cancer Society, there's some good information there in general. That's really good. Um, my practice is here in Rhode Island. I actually have people who've traveled from the South and other parts of New England to see, and I'm always happy to see people. But the other way is, I'm on TikTok just like you guys, and on Insta, and I sometimes will create some videos around this topic, and I get some feedback on my social media from people just asking for some advice. And that's what's one of the reasons, one of the ways I try to answer people. Like you two, I mean, you guys do an incredible job. But you're connected to your communities, and I create these little communities, and people can ask you questions there. Yeah.
Yes, I hope one thing that people who are listening got out of this is it's good to talk about it. Yes, yes. If you're struggling, to definitely state it and talk about it.
Oh, 100%. I mean, I think Coach K, you said right. This is a whole part of being a human being. Now, I gotta say, it's like one of the funniest things I've ever experience was a woman who came to see me at the advice of her gynecologist, right? So she had a partner, older woman in her 70s, and she came to see me for sexual health because her gynecologist was saying, you deserve a better sex life, right? I was like, well, so I was like, well, how do you feel about your sex life? She's like, I'm happy with it. I was like, so what, I'm not, what does she think you need to, what does she need you to do? So much of this is driven by what we think sex life should be like. But I think, there's so many women who are like, oh, I don't talk to my husband anymore. Or he sleeps in a separate room, and I don't even, that part of me, chapter is closed. I'm done with it. And that's okay too, right? It's like people don't, they experience intimacy, they experience joy very different ways. And, I have like couples where they live in separate homes and they're still married and they're still intimate, but it's a different kind of intimacy. So I think the other part is just because I have a schema for my sexuality, it doesn't mean it's yours, and it doesn't, and you can, and that's okay. That we can't tell each other what our sex life should be like, but I want to know where you want to be, so I can help you get there.
Wow. Thank you so much, Dr. Don. You've been a pleasure. You're welcome on the show anytime. Yes. And thank you so much for all the work that you do. We really appreciate having you.
I'm just happy
Absolutely.
you both are in here. You're both in this space. I think it's amazing. And thank you so much for having me on because I think you're both amazing. Thank you so much.
All right. This has been the Bringing Intimacy Back show. We'll take a short break and we'll be back in a moment.
Improving intimacy, everyday expressions is all about you and your partner. Opportunities for intimacy are scattered endlessly within every second of life you create together with your partner. Everyday expressions will educate you and open your eyes to just how great your relationship could be with a little TLC. Improving intimacy, everyday expressions provides a true baseline for the strength in your relationship you've been looking for. Available in Kindle, Audible, and paperback.
Welcome back to the Bringing Intimacy show, where intimacy is real. That was so enlightening, informative, very respectful, and really, I think a lot of people who are listening got a lot of information and resources, and to help that, connection, because sometimes people feel like once they have an illness, they have to give up everything in life. And so there's hope.
Absolutely. I'm so grateful that we had this discussion because cancer is extremely common. It's way more common than we would like it to be. And to not be able to talk about the sexual aspect when you're talking about everything else with the doctor. And I get it, every doctor is not going to be comfortable. So I appreciate that we have people like Dr. Don who said, hey, there's a gap. Let me do something to fill that gap. And I can appreciate that there are people like us that if there is a doctor says, hey, I'm not touching that with a 10-foot pole, I'm just going to send them there. That they understand that that's what being a sexologist and being a doctor of sex, that's what we do. We're not here to teach people how to have sex. We're here to support your sexual goals and needs in all aspects of life. So this conversation was amazing. And I know we have even more amazing conversations that are coming up. So I'm going to let you all know about those shows that's coming up next week on June the 20th. We have the 10 best date night ideas for an unforgettable evenings with Dr. April and myself. On June the 27th, we have Intimacy is a Trust Fall. That's going to be Roman Waden. And then on July the 4th, already July the 4th, we're going to take a recap of dating games and bring play back to your love life. So I'm super excited about those topics and for whoever's going to catch this replay.
Yes, definitely. And so this has been a great show. Please go back and listen to it. If you missed any part of it, and we will definitely see you guys next week. And this has been the Bringing Intimacy Back show, where intimacy is real. See you guys later. Bye.
Bye, everybody.
Thank you for listening to today's episode of Bringing Intimacy Back, where intimacy is real. You can also find us at bringingintimacyback.com, LinkedIn, Facebook, Instagram, Twitter, and YouTube. Dr. April Brown's 7-book series, Improving Intimacy, is now on Amazon. We'll see you next Thursday at 3:30 p.m. Don't forget to follow, share, and subscribe.